Vertigo, understanding its meaning, symptoms, and treatment. Vertigo is a disconcerting and often distressing sensation that affects a person's sense of balance and spatial orientation. It is often described as a feeling of spinning or dizziness, as if the world around you is moving when it's not. This condition can significantly impact a person's daily life, but understanding its causes, symptoms, and available treatments can help manage and alleviate its effects. Understanding vertigo. Vertigo is not a condition in itself but rather a symptom of an underlying issue. It occurs when there is a disturbance in the inner ear or the vestibular system, which is responsible for maintaining balance. The vestibular system includes the semicircular canals and otolith organs in the inner ear, as well as the nerves and brain centers that process balance and spatial information. Common causes of vertigo. 1. Benign paroxysmal positional vertigo, BPPV. BPPV is the most common cause of vertigo. It occurs when small calcium particles in the inner ear become dislodged and disrupt the normal functioning of the semicircular canals. Changes in head position trigger sudden and intense vertigo episodes. 2. Vestibular neuritis or labyrinthitis. These conditions involve inflammation of the vestibular nerve or inner ear structures, often caused by viral infections. They can lead to vertigo, along with symptoms like hearing loss, nausea, and vomiting. 3. Meniere's disease. This chronic inner ear disorder can cause vertigo episodes, often accompanied by tinnitus, ringing in the ears, and hearing loss. Its exact cause is unclear, but it is thought to involve fluid buildup in the inner ear. 4. Migraines. Certain types of migraines, known as vestibular migraines, can produce vertigo as a symptom. These migraines are typically accompanied by severe headaches. 5. Medications. Some medications, especially those that affect the inner ear or vestibular system, can lead to vertigo as a side effect. 6. Injury or trauma. Head injuries or trauma to the ear can damage the inner ear or vestibular nerve, resulting in vertigo. 7. Other causes. Less common causes of vertigo include tumors, blood vessel abnormalities, and neurological disorders. Symptoms of vertigo. Vertigo is characterized by several distinct symptoms. 1. Spinning sensation. The hallmark symptom of vertigo is a spinning sensation. People often describe feeling as though they or their surroundings are moving or rotating. 2. Nausea and vomiting. The disorienting feeling of vertigo can lead to nausea and, in severe cases, vomiting. 3. Unsteadiness. Individuals with vertigo may have difficulty maintaining balance and may stumble or fall. 4. Sweating. Vertigo episodes can trigger sweating and increased anxiety. 5. Nystagmus. Rapid, involuntary eye movements, nystagmus, often accompany vertigo and can be observed by a healthcare provider during an examination. 6. Hearing changes. In some cases, vertigo is associated with hearing loss or tinnitus, ringing in the ears. Treatment for vertigo. The treatment of vertigo depends on its underlying cause. Here are some common approaches. 1. Epley maneuver. For BPPV, this series of head and body movements can help reposition the displaced calcium particles in the inner ear, alleviating vertigo. It is typically performed by a healthcare professional. 2. Medications. Medications may be prescribed to manage vertigo symptoms, especially in cases related to Meniere's disease, vestibular neuritis, or migraines. These may include anti-nausea drugs, anti-vertigo drugs, for example, meclizine, and steroids to reduce inflammation. 3. Physical therapy. Vestibular rehabilitation therapy, VRT, involves specific exercises to improve balance and reduce vertigo symptoms. It is often recommended for various causes of vertigo. 4. Lifestyle modifications. In cases related to Meniere's disease or migraines, lifestyle changes such as dietary modifications, for example, reduced salt intake, stress management, and avoiding triggers can help manage vertigo. 5. Surgical interventions. For severe or intractable cases of vertigo, surgical options may be considered. These can include procedures to reduce inner ear fluid, for example, endolymphatic sac decompression, or the placement of a cochlear implant in the case of Meniere's disease. 6. Medication adjustments. If medications are the cause of vertigo, a healthcare provider may adjust or change the medication regimen. 7. Addressing underlying conditions. In some cases, treating the underlying cause of vertigo, such as an ear infection or a tumor, can resolve the vertigo symptoms. It's crucial to consult a healthcare professional for an accurate diagnosis and appropriate treatment, as the effectiveness of treatment depends on the specific cause of vertigo. Conclusion. Vertigo is a complex and often distressing condition that affects a person's sense of balance and spatial orientation. It can result from various underlying causes, ranging from benign conditions like BPPV to more serious issues such as Meniere's disease or neurological disorders. Effective treatment depends on identifying the root cause and may involve maneuvers, medications, physical therapy, or lifestyle changes. If you or someone you know experiences vertigo, seeking medical advice is essential for proper diagnosis and management.